Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Morning, everyone, and thank you for joining us on World Cancer Day. I think we're ready to go now. Okay, so thank you very much, everyone, for joining us today on World Cancer Day. We will be talking to a panel of different partakers or stakeholders on the cancer journey. My name is Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. So I'd like to firstly thank all those that are on the panel with me, and you have all been introduced. So let's take it on now so we don't waste too much time. The first question I've got, and I'm going to be going very quickly into the questions, is for Jennifer, the president of BioVenture Global. Thank you very much for joining us, and I've got a few questions for you, but let's see how fast we go. Okay, BGVH is a non-profit organization that focuses on improving the health indices globally. So let's now start in looking at the peculiar challenges of the low and middle income countries like Nigeria. What long-term goals or plans does BBGH have to support the care gap for the cancer patients in the country?
Thank you, Dr. Ejo, and it's a pleasure to be here today on World Cancer Day to talk about some of the work that BioVentures for Global Health is conducting in Nigeria to address the cancer gap. Our organization has been working in Nigeria for many years, but we launched our African Access Initiative program focused on improving cancer patient outcomes in 2017 in Nigeria. And we've been working with leading cancer centers and hospitals across the country to understand the gaps and priorities that hospitals have and the healthcare professionals working at those hospitals to treat their patients with a high standard of care. And through our interactions with the chief medical directors, the oncologists, and healthcare professionals, we've gained insights into the gaps and the challenges that they have in treating their cancer patients. And we have been conducting training programs to fill some of those gaps. And those training programs, just over the last year, we've actually conducted more than 10 training programs with international experts from Europe, from the United States, from Nigeria, from around the world, to train more than 1,300 Nigerian healthcare professionals to help them build skills and knowledge where they're identifying gaps, and also to work with the hospitals to facilitate access to the prioritized cancer medicines and technologies that they need to improve the diagnosis and treatment of their patients.
Thank you. Wow, you are doing quite a bit for us in Nigeria. I want to thank you very much for that. I'm going now on to Dr. Jamita. Dr. Jamita, good morning and thank you. I know you are in Abuja, so thank you very much for joining us today and welcome again. It has been documented, so this is for Dr. Jamita, that Nigeria has over approximately 100,000 people diagnosed with cancer yearly, and that the functional radiotherapy facilities in the country are less than 10 totally. Now, I'm thinking now from a maths perspective that 2 million people I live with cancer. Wow, let's see how that goes. This means patients must travel hours, need a lot of money to be able to move around. So my question to you is, what do you think can be done to ease the movement? Travel hours for for them, for those that have to travel to get care across the country?
Okay, thank you for having me on the show. It's a pleasure being here once again. So I'll just very quickly go through the question. Well, reports, definitely. I think I need to also reiterate that. I know much has been said about the radiotherapy facility and the population ratio, but, you know, programs like this are opportunities for us to sort of re-emphasize and reinforce the information. So reports show that one radiotherapy machine should be, that's the ratio radiotherapy machine and population should have 1 machine to 500,000 population. Now we are, of course, as you mentioned, we are a low middle income economy. So let's even scale it up a bit. So let's just say one radiotherapy machine should go for a million population. So of course, you know, we are way below the minimum. So what we are appealing to, not just the government, you know, because definitely government is burdened with a lot of issues. So we are appealing to the NGOs, well-meaning Nigerians, key opinion leaders, to see how they can sort of key in to ensuring that there are more, the numbers of radiotherapy machines in the country, you know, go up. Now, when we talk of radiotherapy machines, we don't just talk of the external beam, because we have the external beam and we have the brachytherapy. So we have brachytherapy machines in the country at the moment for prostate cancer and for gynecological cancers. Now, the numbers, like I said, they are way below a minimum. We're, you know, operating at less than 10% of what we should have. So, you know, from two aspects, I feel the government and anybody who is able to, you know, should sort of assist and, you know, come in to the oncology space and ensure that the numbers, you know, gradually the numbers should go up. We should have at least 3 in each state and maybe 5 radiotherapy machines in the, you know, more densely populated states. Now, on the other aspect, since for now we do not have radiotherapy machines in all the states, is obvious, you know, we can at least somehow, I would say, ease the stress on the patients, because patients do have to travel long distances. Patients have to travel days, you know, to receive treatment in some of these places. So you can imagine a patient traveling from the south all the way to the north. And, you know, Nigeria, you know, our expanse, you know, so patients really go through a lot. So what we're also saying is that if in the interim, before these radiotherapy machines do come, or before they, you know, become operational, if the government can some way, government or the treatment centers can some way make provisions for, you know, having like a secure and organized transportation of these patients. Now, in some societies, they do have provisions made where the patients, even though they're in the same locality, not too far away, they have provisions for transporting the patients from their homes, from their, you know, from where they live to the treatment centers. So how much more where we have, you know, where patients have to travel days. So I think this is really important. And then also the aspect of accommodation. So I think I'll just chip that in, because sometimes patients have to travel not just alone, they will need a relative or somebody to give some support. And then radiotherapy treatment, you know, can take as long as a month or sometimes as much as 6 weeks. So they have to be in these treatment centers for that long. So, you know, if they can provide some level of accommodation for them whilst they stay in those places, because sometimes there's some patients who they have never been to Lagos, or they've never been to Abuja, you know, they are not conversant with the language, with the people. So, you know, they do need some comfort in terms of transportation and accommodation. So I would say those are the areas. First of all, to increase the number of radiotherapy facilities. Second of all, in the interim, to be able to, you know, provide some form of safe and organized transportation of these patients to the treatment centers, and then, you know, accommodation as well. I think those are the areas. Thank you.
Thank you. You've actually touched quite some very sensitive issues, and I'm actually looking at it from a personal perspective. You see, one of these discussions that are why it's very dear to me is because I am living in it, so I know how we patients feel on this experience. So let's go to Dr. Shigaya. Good morning, and thank you for joining us. Let's see where you're coming from this morning. Oh yes, you're all scrubbed up, aren't you?
Good morning. Thank you for having me.
What ways, in your opinion, do you feel screening activities can be improved, especially in the rural communities nationally across Nigeria?
Well, the aim of screening, first things first, is to catch the patients, make them aware, so that people have a high index of suspicion, and then you can, find the diseases early. Now, the peculiarity of the rural areas is that most of the oncologists are centered in the urban areas. But for me, if you ask me honestly, I'd say in the rural areas, the primary health care can actually handle screening. Just like the way we handled immunization some years back, I think we could also do the same thing with cancer awareness. If we have the community health care workers, the community health extension workers, and we really take it to the grassroots, not only do we have people who the rural people are comfortable with, it probably can be done in their own local language. And some cultures are peculiar with some, they have different beliefs. If you have someone who you already trust and who's in the society, who has been trained about this screening, and they're the ones who are bringing this message to you, I think it would be better taken. Another thing we could do is we could have, social media is in the urban areas, but it's beginning to seep into the rural areas. We could have chants, we could have songs, we could just make it a way of life where we all know, even in the rural areas, people use driver's licenses. So that as you're getting your driver's license, you're being asked to do your basic screening for your appropriate age. So those are little things, like I keep on saying, high index of suspicion. You only recognize what you know. If it's not something discussed, it will never occur to you. So in that little clinic, in that village, where that traditional birth attendant is handling the pregnant women, if she's taught how to discuss pap smears, if she's taught her to do breast examinations, if she's taught her to talk about the basic things, we don't expect them to become specialists, but let them just know what the basics are. It will definitely go a long way. Because gone are the days where we, it was just come to the city to get care. If you catch them early at the rurals, who now gets transferred to the apex centers is at an earlier stage, and makes it easier, cheaper, and makes the prognosis also better.
I want to say a very big thank you to you, because what kept going through my head firstly was the fact that actually in Nigeria we have to give credit to a lot of NGOs, I'm one of them, that actually bring in some sort of support to you, the medical teams that are working for us. And so I want to say a very big thank you to you. I'm going to talk to a survivor like myself, but I'm not asking you the questions. So Ms. Lamre, I've got a nice question for you, and I want you see, I stuck in the middle of my session. I want you to tell me, what was the most difficult part of your journey or the treatment, and what aspects do you think could have been dealt with better? Considering you're coming from a very different background now on this journey, what would you have done differently? Or what would you have hoped?
Right. The most difficult part, good morning everyone, and thank you for all the information I'm getting. It's quite encouraging to just hear what you guys are saying. But for me, it was actually breaking the news to my family, because I never ever thought it can be me. I didn't, even though I'm living in this part of the world, I never really knew how to examine myself. I wasn't thinking about it at all, so it was quite difficult for me to break it to my children. I'm back home to my mom, my brothers, my family generally. That was the most difficult part for me. And then another part is when they put the PICC line inside my arm. You know how they do it, they put it in your arm, it goes straight into your heart, and they give you all this information about if anything happens. And it's like, whoa, it's a lot of information coming to you at the same time. And it was just difficult for me. Anytime I go in, I'm always praying that I get out and that the PICC line does not have any problems, or it doesn't, get infected and things like that. And getting back home, it takes me about 4 days. I'm completely knocked out. But I don't know, maybe it's because of the level of the cancer. I wish I caught it earlier. If I knew earlier, then I would probably, it won't be that hard. But this was grade 3 going to grade 4. So it was a bit difficult for me to hear all these and take it on. Yeah. So what was the second question again?
I think you've done both of them actually.
Okay.
Yeah. Thank you for sharing them, Larry. I know that a lot of people don't really like talking about this journey, and yes, I do identify with you. So. Jennifer, we've got you back on. Can you please help us with this? Now you're listening to the conversation from different perspectives. So now I'm going to ask you another question. In your opinion, how has BVGH engaged with decision making in helping to close the care gap in Nigeria?
So, as I had said, our model is to understand from the ground up what is needed from the oncologists, the healthcare providers, but also I think listening to the patients' voices and the patients' stories is critically important as well. And hearing Lanray talk about some of her challenges, one of the hospitals that we're working quite closely with is the Nigeria Sovereign Investment Authority Lagos University Teaching Hospital Cancer Center, or NLCC. And the CEO of that hospital specifically asked BVGH to work with the oncology healthcare team to develop communication materials for the oncologists and the nurses to actually be able to communicate more effectively and empathetically with patients, because we're hearing, Lanray, how difficult it is to hear this news, which I can imagine, but also for the oncologists that have to convey that news. What I've also heard is that's very challenging as well. And so we actually worked with the oncology team at NLCC and also at the Ahmadu Bello University Teaching Hospital, where the Vice Chancellor and the CMD and the team are also quite committed to building capacity and improving cancer patient care at the hospital. And we developed modules on communicating with patients. And so that was one area that was directly related to patient materials and improving that communication channel between physicians and patients. We also worked to develop materials for the healthcare professional teams to share with patients, to help them to take some of that information home with them and be able to digest it after the overwhelming information that is conveyed initially to patients. And we've continued to work with the hospital teams to obviously conduct the training and the capacity building, but beyond that, we've also started to support the oncologists in conducting some research through a program that actually Takeda Pharmaceuticals has supported to provide grants to the oncologists to help them start to ask questions and conceive of some of the research that they want to conduct to understand how to help improve their cancer patient outcomes. And those grants were just issued last year, and those studies are underway. And those research programs also, we've created mentorships or a thought partner link with some international experts, if that was to be helpful to the oncologists conducting the research. So I think research is another important area, because it's been shown that patients that are in clinical trials do better, because the care that patients get is quite rigorous when a patient is in a study. So I do believe one of the areas that we're working in that will have an important impact in Nigeria is facilitating that research, and most importantly, the research that's conceived by the oncologists in Nigeria, not the ideas that are coming from outside the country. So we're very excited to have launched this grant program and to be supporting some of the oncologists at the hospitals that we're working with in Nigeria on that program, and importantly, the linkages with experts around the world. So there's that thought partner and mentorship role that's ongoing. And then finally, I'll just say we also developed a platform. Earlier diagnosis is obviously critical to help improve patient outcomes. And after conducting a pathology training program, the pathologists in Nigeria said we need something that's ongoing regularly to help share information about cases and have thought partners and experts that can look at cases and histology with us to provide different opinions. And so we've developed a digital platform where in real time, Nigerian pathologists can share a case and they can share images. And within 24 hours, a pathologist from the United States, it's United States, Nigeria, this program, will actually provide an opinion and discuss the case with the pathologist in Nigeria. So that's another valuable tool of knowledge sharing and thought partnership on sharing experiences that we've gotten very positive feedback from the participants in Nigeria.
Thank you for sharing that, because one of the things I think I am actually in a clinical study. I think yes, I am one of them, and I'm actually one of those that are doing well. So let's keep our fingers crossed. But yes, so it's very interesting. Thank you, and I really hope that I want to actually encourage Nigerians who are watching. If you ever find people, please try and be in the clinical trials, because it does help the doctors, especially those in Nigeria, be able to get the data they require to help us out there, bearing in mind our DNAs are all very different. Thank you. Dr. Shagaya, I've got one more for you, I think. As a radio and clinical oncologist, I believe you are a member of one of the global medical boards or oncology boards. How has the professional body been able to engage decision makers in the country to fill in the care gaps?
Okay, I belong to the main big body, is the Association for Radiation and Clinical Oncologists, called ARCON. We started a few years ago. We're really relatively new, but it's amazing how much they've been able to do. When we came on board in Nigeria, cancer care was being done by everybody. As long as you felt like it, you did it. You didn't have to follow a guideline or protocol. You just did what you felt like, whatever you remembered from medical school. We're a little under 100 of us in that association. And what we've been able to do in collaboration with the Federal Ministry of Health is to ensure that things like chemotherapy, if they have to be administered, one, the drugs must be procured from the right place, storage, content, all that is sorted out. And then we've also been able to establish that it's given under chemo-safe principles, meaning that they are compounded by the right people in the right environment. Dosages and monitoring is all, guarded. And this has been, done by the Federal Ministry of Health with help of ARCON. Another thing we did last year during the International Cancer Week was to go over guidelines. And we ended up with the NCCN guidelines, the ones which have been harmonized for sub-Saharan Africa. The federal government, the communique back to them, they got a group of specialists from all over the country. We looked at all the different guidelines, looked at the work people had done, because we still are lacking with our own local information and data. And at the end of the day, the recommendation was that this should be adopted by all the federal institutions and trickle down. So right now, with the help of ARCON, the NCCN guidelines for the sub-Saharan Africa is being pushed forward. That notwithstanding, now patients are beginning to ask to see specialists, because we've made quite a lot of noise about it. All doctors are important. The multidisciplinary team is important. However, it's important that your care is channeled and planned out by the right people. ARCON is still doing this and is beginning to get those policies out. there's still a few things down the line and pipeline. Since they haven't been approved, I don't want to discuss them here. But I tell you, now patients are beginning to come and say, I want to see an oncologist. And I think that is as a result.
Fantastic.
Yes, that's as a result.
We're making progress.
It is. Definitely is.
Thank you. Dr. Jamita, I'm going to ask you a question. Can you give us, please, the top three gaps or barriers to cancer care in your everyday practice? Just the top three, because we have a way, we can have many, but we don't get through. So that we as a country, as participants, as stakeholders, the top three you would pick up and say, these are the top three barriers in the cancer care in the everyday Nigerian. It's like Dr. Jamita.
Okay, thank you. First of all, I would just like to appreciate Lanre Lasisi for being here. I really want to commend you, for speaking out. I mean, it's really going to encourage a lot of other cancer survivors out there to come out and speak up. So thank you so much. So yes, the three top barriers for me in my everyday practice, of course, of course you said three. I initially wanted to say finance, but of course, definitely it's finances, and finances affects both the rich and the poor, really. But of course, more so for those who are, who live below poverty line. So no matter how, I tell people that no matter how deep you think your pockets are, if you are paying for cancer treatment, you are going to really be shaken up. It's really expensive, from the surgery, the chemotherapy, the radiotherapy, immunotherapy. So it's really definitely a challenge for people to be able to come up with the finances. Of course, as it is, largely finances are done still out of pocket. But there are a lot of initiatives that have been coming up, which have been pioneered by the government to ensure that some of these services are given to people who desperately need them at subsidized or at no cost at all. So these things are still ongoing. So finances, then definitely other issues that I have encountered are things like access. I know in access, there are certain aspects of access too that would talk about. That's affordability, which is finances, and then availability. So you may have the funds, you may have the money, but the radiotherapy machines or the treatment that you need is not available to you. So it all boils down to access, doesn't it? So thirdly, also what I have encountered are issues like fear, really, from the patient, because the patient is afraid that the treatment, the side effects will even kill them faster than the disease itself. So fear has been one of the challenges that I have experienced in my everyday practice. And then we have to keep talking to the patient, helping the patient digest. Jennifer did touch on that, the patient being able to digest so much information at the same time. So there's that aspect of fear, there's the aspect of digesting the information. Is this thing really happening to me? So so that's a process. It's a bit slow for the patient to come up and say, okay, I have decided I really want to start treatment. Then, sorry, let me just chip in. There's also the issue of navigation. The patient is somehow lost in the process, where to go. Yes, I'm in the hospital, I'm supposed to see the surgeon on Monday, I'm supposed to see the radiologist on Tuesday, so that navigation process too has been a challenge. Sometimes in my practice, I see patients, when we're done with the consultation, they come back an hour or so. Doctor, what did you say? You said I should go where, to do what? So that process to navigation also has been a challenge, and it's what we see in our everyday practice. So I also want to say that no economy has it all. Economies, even the best of economies, they do have their barriers. So why we do bring up all these things is just because we want to, as much as possible, improve care so that patients would be able to have the best.
Thank you very much. I want to say a very big thank you to everyone. The last question I would have asked, Jennifer already answered quite a lot of it, so I'd like to say a very big thank you to everyone for joining us this morning. Thank you for participating. Thank you all, various stakeholders. Larry, thank you very much. I know that for all of us that have to talk about this journey, it is not easy, so I want to thank everybody, Dr. Jumai, Dr. Nina, Larry. And Jennifer, thank you. You're still awake. Thank you very much for joining us, and we look forward to talking again. You can follow us on Cornwood Cancer Foundation, our Facebook page, our Instagram page. Our website has information, so for everybody, you can find us somewhere. We look forward to talking to you again next week. Thank you.